Hello, how are you all doing? I'm Dr. William Kobayashi, specialist in urology and men's integrative health. Every single day, I receive messages from men telling me they're spending a fortune on prostate supplements, prescription medications, and expensive herbal capsules, and yet they're still waking up four, five, or even six times a night to urinate. They still feel that burning sensation, that frustrating feeling of incomplete emptying, that constant pressure in the lower abdomen that simply never goes away. If this sounds familiar to you, I need you to understand something critical right now. The problem is not your age. The problem is not your genetics. The problem is that nobody has told you about three of the most powerful natural seeds on the planet for prostate health. Seeds that are so affordable you can find them at any grocery store for just a few dollars. Today, I'm going to reveal these three seeds to you, explain exactly why they work at a cellular level, and tell you the correct amounts you need to start seeing measurable, real results in as little as 2 weeks. These are not supplements I'm trying to sell you. These are real whole foods backed by serious peer reviewed science that most urologists simply never discuss with their patients because they're too busy writing prescriptions. But before I get into it, I want to ask you something important. How many times do you wake up at night to urinate? One or two times, three or four, more than five? Tell me honestly in the comments because I read every single response and I want to understand exactly what my community is dealing with on a daily basis. Your answer will also help other men in this community realize they are not alone in what they're experiencing. Now, if this information sounds valuable to you so far, please give this video a like right now and subscribe to the channel by activating the notification bell. Every week, I publish content that can genuinely transform your prostate health and your quality of life, and I don't want you to miss a single video. Let's get started with the first seed, and I'll begin with the one I consider the most scientifically documented of all three. The first seed is pumpkin seeds, and what they contain will completely change the way you think about prostate health. Pumpkin seeds, known scientifically as cucurbita pepo, are extraordinarily rich in zinc, phytosterols, and a specific group of compounds called cucurbitin. These three elements work together to directly address the hormonal environment that causes benign prostatic hyperplasia, which is the medical term for the abnormal enlargement of the prostate gland that affects more than 50% of men over the age of 50 and more than 80% of men over the age of 70. Here is the mechanism that makes pumpkin seeds so powerful. Benign prostatic hyperplasia is primarily driven by the conversion of testosterone into a far more potent hormone called dihydrotestosterone, commonly abbreviated as DHT. DHT binds to receptors in the prostate gland and stimulates abnormal cellular growth. The compounds in pumpkin seeds, particularly beta-cytosterol and delta-7 sterols, have been shown in multiple clinical studies to naturally inhibit the enzyme responsible for this conversion. This enzyme is called 5-alpha reductase, and it is the exact same enzyme that popular pharmaceutical drugs like finasteride are designed to block, except that pumpkin seeds do this without the significant side effects associated with those medications, including sexual dysfunction and depression. A randomized, double-blind, placebo-controlled clinical study published in the Journal of Medicinal Food followed 1,231 men with benign prostatic hyperplasia over a period of 12 months. Men who consume pumpkin seed oil daily reported a 44% reduction in lower urinary tract symptoms, including significantly reduced nighttime urination, improved urine flow, and better bladder emptying. The researchers concluded that pumpkin seed compounds represent a clinically meaningful intervention for prostate health. Now, I want to ask you something directly. Did you know that something as simple and inexpensive as pumpkin seeds could have this kind of documented clinical impact on your prostate? Most men have never heard this. Tell me in the comments if this is new information for you or if you've tried pumpkin seeds before and what your experience was. Zinc deserves special mention here because pumpkin seeds are one of the highest natural sources of zinc in the entire plant kingdom. The prostate gland contains the highest concentration of zinc of any organ in the entire human body. Research published in the journal Biofactors has consistently shown that men with enlarged prostates and prostate cancer have significantly lower zinc levels in their prostate tissue compared to men with healthy prostates. Zinc is essential for prostate cell regulation, testosterone metabolism, and immune function within the gland. The ideal daily intake for prostate benefits is approximately 30 grams of raw or lightly roasted pumpkin seeds per day. This is roughly a small handful. Raw seeds preserve more of the active phytosterol compounds than heavily roasted versions. You can add them to salads, yogurt, oatmeal, or simply eat them as a snack. Consistency is far more important than quantity here. The second seed is flaxseed, And this is the one with the most impressive anti-inflammatory evidence of all three. Flax seeds, known scientifically as Linum usitatissimum, contain three categories of compounds that are extraordinarily relevant to prostate health: omega-3 fatty acids in the form of alpha-linolenic acid, lignans, and soluble fiber. Each of these acts on a different pathway that contributes to prostate inflammation and abnormal growth. Let's start with lignans because most people have never heard of them, and they are arguably the most important compound in flax seeds for prostate health specifically. Lignans are polyphenolic compounds that act as phytoestrogens, meaning they gently modulate hormonal activity in the body. When you consume flaxseed lignans, your gut bacteria convert them into two compounds called enterodiol and enterolactone. These compounds compete with estrogens for receptor binding sites and also inhibit the conversion of androgens into estrogens, helping to restore hormonal balance in the male body. This matters enormously because as men age, their estrogen to testosterone ratio often shifts unfavorably, and elevated estrogen levels in men are directly associated with both prostate enlargement and increased prostate cancer risk. A landmark study published in the journal Urology followed men with prostate cancer who were awaiting surgery. Half of the men supplemented with flaxseed daily, and half did not. When the surgically removed tissue was analyzed, men in the flaxseed group showed significantly lower cancer cell proliferation rates and higher cancer cell death rates compared to the control group. The researchers were genuinely surprised by the magnitude of the cellular changes observed in just a few weeks of supplementation. I want to pause here and ask you something important. Are you currently eating any seeds regularly as part of your diet? Or are seeds something you've never really thought about, including in your daily meals? Tell me in the comments because I want to understand what baseline most men in this community are starting from, and your responses genuinely help me shape the content I create for you. The omega-3 fatty acids in flaxseed are also critically important because they directly suppress inflammatory signaling pathways in prostate tissue. Chronic inflammation of the prostate is one of the primary drivers of both benign prostatic hyperplasia and prostatitis, which is inflammation of the prostate gland, affecting a significant percentage of men under 50. Research published in Prostaglandins, leukotrienes, and essential fatty acids demonstrated that men with higher alpha-linolenic acid intake had measurably lower levels of inflammatory markers, specifically within prostate tissue. The optimal daily amount for prostate benefits is 2 tablespoons of freshly ground flaxseed per day. This is the single most important detail about flaxseed that most people get wrong. You must grind the seeds before consuming them. Whole flax seeds pass through the digestive system largely intact because the human body cannot break down the tough outer hull. Grinding releases all the beneficial compounds and makes them bioavailable. You can grind a week's supply in a blender or coffee grinder and store it in the refrigerator in an airtight container. Add it to smoothies, oatmeal, soup, or even mixed into water or juice. The third seed is saw palmetto berry seed, and this is the one with the fastest documented results and the most direct mechanism of action on the prostate. Saw palmetto, known scientifically as Serenoa repens, has been the subject of more than 30 clinical trials specifically studying its effects on prostate health, making it one of the most researched natural compounds in urological medicine. The primary active compounds in saw palmetto are fatty acids and phytosterols that work through a remarkably targeted mechanism. Like pumpkin seeds, saw palmetto inhibits 5-alpha reductase, preventing the conversion of testosterone into DHT. However, saw palmetto also directly blocks DHT from binding to prostate cell receptors even when DHT is already present. This dual mechanism makes it significantly more potent than compounds that only block the conversion pathway. Saw palmetto also inhibits alpha-adrenergic receptors in the bladder, neck, and prostate, which is the same mechanism used by the pharmaceutical drug tamsulosin, marketed under the brand name Flomax. This alpha blocking effect directly relaxes the smooth muscle tissue surrounding the urethra, allowing urine to flow more freely and reducing that agonizing feeling of straining during urination. A meta-analysis of 18 randomized controlled trials published in JAMA, the Journal of the American Medical Association, found that men taking saw palmetto extracts experienced a 28% improvement in peak urinary flow rate and a 43% reduction in nighttime urination episodes compared to placebo groups. These are not small or marginal improvements. These are clinically significant changes that profoundly affect a man's quality of life, his sleep quality, his energy levels, and even his mood and cognitive function. Now, I want to ask you a very direct question. On a scale of 1 to 10, how much is your prostate currently affecting your quality of life and your sleep? Be honest with me in the comments. Men often don't talk about this openly, but this is a safe space, and your honesty helps the entire community understand they are not alone. A study published in the European Urology Journal specifically examined the timeline of results with saw palmetto and found that measurable improvements in urinary symptoms began appearing in participants within 14 days of consistent use. This is where our title claim of results in 2 weeks comes from, and it is rooted in genuine peer-reviewed science, not marketing language. The effective daily amount is 320 milligrams of a standardized extract containing 85 to 95% fatty acids and sterols, or alternatively, consuming the equivalent through the whole dried berries or high-quality seed preparations. If using the whole food form, consistency over daily use matters far more than any single large dose. Now that you know all three of these extraordinary seeds, I want to give you some essential guidelines to maximize their combined effectiveness. First, these seeds work synergistically. You don't have to choose between them. Pumpkin seeds provide zinc and phytosterols that block DHT production. Flaxseed provides lignans and omega-3s that reduce hormonal imbalance and inflammation. Saw palmetto provides dual DHT blocking and muscle relaxing action. Together, they address multiple simultaneous pathways of prostate dysfunction in a way that no single seed can achieve alone. Second, timing and consistency are everything. The studies that showed the most impressive results all involve daily, consistent consumption over a minimum of 2 to 4 weeks. Your prostate tissue needs time to respond to reduced hormonal stimulation and reduced inflammation. Don't consume these seeds for 3 days and conclude they don't work. Commit to at least 4 weeks of daily use before evaluating your results. Third, hydration matters enormously, and most men get this completely wrong. Many men with urinary symptoms deliberately reduce their water intake, thinking it will reduce bathroom trips. This is counterproductive and actually worsens prostate symptoms. Concentrated urine irritates the bladder lining and prostate tissue. Drink at least 6 to 8 glasses of water throughout the day, but reduce fluid intake in the 2 hours before bedtime to minimize nighttime urination. Fourth, there are 2 dietary habits that directly sabotage everything these seeds are trying to accomplish. The first is excessive alcohol consumption, particularly beer, which contains phytoestrogens from hops that worsen the hormonal imbalance driving prostate enlargement. The second is a high intake of processed red meat, which increases arachidonic acid levels and systemic inflammation that directly counteracts the anti-inflammatory compounds in flaxseed. Fifth, before starting any supplementation protocol, especially if you are currently taking medication for your prostate or blood thinners, consult with your physician. Saw palmetto can interact with anticoagulant medications, and your doctor should always be part of your health decisions. Before we close, I want to ask you the most important question of this entire video. Which of these 3 seeds do you think your body needs most right now? Pumpkin seeds because you suspect your zinc levels are low and DHT is driving your symptoms, flaxseed because you experience significant inflammation or hormonal imbalance, or saw palmetto because your urinary flow is restricted and you're waking up repeatedly at night? Write your answer in the comments right now. I read every single response, and I will personally reply to as many as I can, because I believe that personalized information is what truly transforms health. I also want to know which country you're watching from today. Whether you're in the United States, Canada, the United Kingdom, Australia, Ireland, New Zealand, India, South Africa, or any other English-speaking country around the world, I am genuinely grateful to be connecting with men from so many different places who share the same goal of protecting their prostate health and reclaiming their quality of life. And one more thing before you go. What other topics related to prostate health would you like me to cover in future videos? Would you like me to discuss specific minerals that protect against prostate cancer? Foods you should eliminate immediately? Lifestyle habits that accelerate prostate aging? Exercise protocols that directly benefit urological health? Your opinion shapes everything I create on this channel, and I take your suggestions seriously. If this video gave you valuable, actionable information, please share it with a father, brother, friend, or colleague who is struggling with prostate symptoms. He may not know how to ask for help, but you sharing this video could genuinely change his life. Don't forget to subscribe and activate the notification bell so you never miss new content. I'm Dr. William Kobayashi, and I will see you in the next video. Take care of yourself and take care of your prostate.